Some people consider it to be the fountain of youth, neck and facelifts. The procedure can really take years off. So joining us now to explain those procedures, Dr. Bridges with Bridges to Beauty. He's going to be answering all of your questions about neck and facelifts for the next half hour. We really want to encourage you to ask all of the questions on your mind. So if you're online, just fill out the information on your screen and submit it, and we'll get right to it. Or give us a phone call. That number is 318-219-4569. We're going to be taking all of your questions until 12:30, so don't be shy. Dr. Bridges, start us off with telling us a little bit about each of the procedures, and you can also get them done. You can get them done separately or together, right?
Yeah, facelift usually combines several procedures, depending upon the person, really. You know, it's common for middle-aged woman, maybe a little older, come in and complain that basically her neck is making her look older, her lower face is making her look older because she has jowls now. Nasolabial folds tend to be kind of deep. In those cases, you would do multiple little procedures for the nasolabial fold as well as for the neck. The neck basically makes people look older probably quicker. Right? And what you're doing is you got to remember that the skin of the face has followed the deep tissues kind of downward. Okay, the ladies that come in that have these little bands here, that's part of what's called the platysmal muscle. It's not really extra skin falling forward by itself. It's just that there's a muscle that goes along the middle portion of your neck, and as it gets shorter, it's called a bowstringing effect. What I mean is like, imagine this to be the bow. Okay, if this muscle got shorter, it would do this.
Gotcha.
So that's where it comes from. It's not really skin. You know, people come in and say, well, I got too much extra skin there. It's a combination that basically the structures underneath has led to the shapes you see on the outside.
Yeah, because form follows function, right?
Yes, and for people with little minimal things like, the jowls or maybe little fatty areas underneath the skin that basically have good, skin quality, something as simple as a smart lipo or something would probably be better for them, because it's and those who really need a facelift, their skin quality is not very good. The surface area of the skin is more than it needs to be. So you really actually have to do skin resections as well as take the deep tissues, again, because they have fallen too, place them back up to where they used to live, okay, and then take off the extra skin.
Okay, and then you do it by, where do you put the incisions? The
incisions go in from the ear and behind the ear.
Behind the ear?
Yeah. And
why is that?
Well, you remember that this skin here and this skin here basically they're connected together.
Okay.
Most people who are going to get a facelift or even neck lift end up with a facelift and neck lift together. Because that you can't really separate the two. If you make an incision here alone, pull the skin up, and people have lots of extra skin to pull, it'll start wadding up in front of the ear. Okay, so basically you're going to place the incision back here. It's going to bring this neck skin up. Okay, and then suture that in place.
Okay.
Also, I like to make a little counter incision up here, address the fact that those muscles have shortened, tie them back together to where they used to live, and that gives the best overall neck angle.
Who's a good candidate for all of this?
Well, really those people who are concerned about the premature aging. I mean, basically most people don't feel as old as they look, and so most of the women are in the late 40s on up into the 70s. Men get it too. They generally have problems with the neck as well as the jowls. In their case, doing the liposuction and pulling up the skin is probably more important. But men have it not as frequently as women, but they can be candidates too.
Anybody who wouldn't be?
People who are sick. People who basically physiologically are sick or have a poor health record. If they're on some type of blood thinning agent, such as Coumadin or some of the, other aspirin-like products. Aspirin, you need to stop that like 10 days before. Most people can stop that. They're just taking it for heart health, and they really haven't had any heart issues. But things like Coumadin, they really wouldn't be a good candidate for it, because you really have to stop the little bleeding that comes up.
Okay, well, walk me through the whole process here. So if somebody at home is watching and they say, oh, I really would like to do this, they first need to stop by your office, right?
Correct. That's right.
And just be looked at, examined by yourself.
Exactly, and see what features basically are bothering them, okay? And actually what features they do have. Not everybody has, the jowls. Not everybody has the neck component that basically needs to be tightened, or the platysma. If they have deep nasolabial folds, addressing those, in terms of with the facelift. So everybody's a little individual. I mean, there's nobody that's seen that's the same. And so you have to kind of sort that out, and that means having a consultation.
Okay. Okay. I guess who are the main people that come in? Or is it middle-aged women that you're typically seeing?
Middle-aged women up into their 70s.
Now, do they bring in pictures? I know when us women, we get our hair done or whatever, we'll bring in pictures of a famous actress and say, hey, make my hair look like this. Do you have anybody that comes in and says, you know, hey, I really like this person's jawline. Can you give that to me?
Rarely.
Rarely.
It's not common at all. I mean, they might bring even pictures of themselves when they were younger, okay, and point out the features that they liked. But you got to remember, if you bring in, for any type of cosmetic surgery, pictures of someone else that you like, you're not the same. I mean, what you bring to the table is just as important as what I bring to the table. And it's all different.
You just want to look like a better version of yourself, right?
Absolutely, yeah. I mean, your facelift is going to set you back 10, 15 years as far as like the looks. Okay. You know, you want to maintain your weight afterwards, because, you know, if you gain a bunch of weight afterwards, that's going to put stretch on what the repairs that you did. So you really, I mean, you want to be, you know, pretty consistent with your weight. You want to be pretty consistent with, you know, how you maintain the skin. Like, I really like people to, you know, if they're not already on a skin regimen, okay, to be on a skin regimen that has vitamin C serum from retin A, and you know, basically some good moisturizers. Because over time and things, those things will actually improve the skin quality that you might have brought elsewhere. I mean,
Gotcha.
After 35, 40, you know, hormones have changed. You know, women tend to lose more collagen in their skin over time. Retin A, vitamin C serum help build that back, okay, or at least stabilize it. Increases the elasticity of the skin. All those are important components to do afterwards. You can do them before, but afterwards I think is very, very important to maintain your investment.
Okay, we've got a caller on the line. We've got Nancy. Nancy, what's your question?
Well, I've got two questions, actually. I've got a lung disease, and I'm on oxygen, and I would really like to avoid general anesthesia, but I'd love to get a face and neck lift. Is there any way that can be done, like under local anesthesia?
You can do it under local anesthesia. In fact, most of the facelifts are done with local sedation. I mean, you know, we give them a little Versed, a little Demerol and things, and then know if the areas. The issue with the oxygen, I mean, that's not a big issue, but it's what is your arterial oxygen generally run?
Well, when I'm on oxygen, up in, you know, in 96, 97, without being on oxygen, I go below 90. So,
okay. Yeah,
and that was another question I had: would wearing a cannula interfere with like healing on a facelift?
Not really. You know, you might have to position the tubes in a different way, not to put pressure on those areas, because, you know, whatever I do, I'm changing the blood supply, therefore I'm changing the oxygenation of that tissue that we leave behind. And you really want to keep your PO2 up really for that reason. You know, it's kind of like, you know, I really don't like to do facelifts really on smokers, okay, because they will decrease their oxygen delivery to those tissues just by the fact that nicotine tends to vasoconstrict the blood vessels that go there. And when you do a facelift or even a tummy tuck, you're undermining skin, so you're changing the primary blood supply of that area. And if you vasoconstrict it or turn off the oxygen and things, they can lose areas of tissue. In facelifts, it's, you know, it's not common, but some people will lose some tissue behind the ear. Okay, it will heal in and things, it'll be fine, but, you know, it's a bit of a nuisance.
Okay. Do those answer your questions, Nancy?
Yes, it did. Thank you very much.
All right. Thank you so much for calling in. If you have a question for Dr. Bridges, give us a call. That number is 219-4569. Of course, we'll be taking all of your questions until 12:30. All right. So how common is this? Is this one of the more common procedures that you do, or?
Yeah, as far as procedures, it probably ranks number 3 in things I do. I mean, most common are, you know, mommy makeovers, you know, which includes breast augmentation and a lift and a tummy tuck, followed by liposuction, which is probably number 4, because, you know, breast augmentation falls in there too. So those are really top 3, and then facelifts follow.
Okay.
Then followed by eyes. You know, so it's a fairly common procedure for me. It's just that basically, if you had to rank them and things, it would probably fall number 4.
Okay. Well, you were talking about before we took Nancy's phone call about how you need to eat a very good diet and try to maintain a healthy weight,
Right.
because you can get a little bit more stretched out or some of it back. Explain a little bit more about what you were talking about with that, and can you get it redone after you've had it once if things go bad again?
Yeah, as far as the diet goes, I mean, you don't want to be gaining 5 or 10 pounds after a facelift, because even though you do some liposuction, you're still leaving fat behind in some areas, because that gives you the subcutaneous contour that makes us look normal. So the fat cells you leave behind, if you gain weight and things, they will get bigger. Okay, so if you do a submental liposuction and you tighten the muscles up, sometimes that can get a little full again.
Yeah.
I think it's just plain, makes good sense to basically try to maintain your weight after any operation, at least any cosmetic operation, because you will change things if you don't. Now, as far as redo operations, yeah, you can have a second facelift. Joan Rivers has probably had more than just two. But
I think admittedly she, yeah.
Yes, she didn't mind admitting that.
Yeah.
It's an operation that basically, it probably takes a little bit longer, because when you're underneath the skin, there's some scar tissue, and again, you don't want to, jeopardize any nerves and things. But when you've gotten in the plane you need to, and you're tightening things up, I think they tighten up a little bit better, because you're putting stitches into some tissue that basically has more substance to it. Scar tissue tends to hold stitches better than normal, what I call virgin tissue.
Okay. Let's talk about money a little bit here. Is this real expensive?
Yeah, it probably costs between $6,000 to $10,000, depending upon what has to be done at the same time. If you have a facelift and a forehead lift, to kind of get the brows up, that's
what I want, is the forehead.
Yeah.
I got the forehead. You know how everybody kind of has their thing.
Mm-hmm.
I guess I'm always making this face too much, furrowing my brows.
we can solve that.
I have
with,
to try
with
to
a little
relax
Botox.
a little bit.
Yeah.
I call these
Botox
my news wrinkles.
Yeah, and that's where Botox comes in.
Really?
Oh, it really helped that. Yeah.
Can that help other areas too, where you might get a facelift, or is that? I mean, by filling out, does that help other?
Well, you remember the Botox is not a fill. Okay.
Oh, it does. Oh, it relaxes.
It relaxes the
That's
muscles
right.
and stuff. But basically, you'll make this look real calm, and you won't develop little lines there. Okay, if you use it, because all the little wrinkles that we get, especially from here up, are due to muscular movement. And so that chronic muscular movement over time, it's like taking a credit card and bending it back and forth, back and forth, back and forth until you etch a line in it.
Yeah.
Because when we were young, we had more elasticity in the skin. As we get older, the elasticity gets less, and so it becomes more plastic than elastic. And so Botox is very, very good for that. I mean, it's a preventative in young people and things, and in older people, it certainly gets rid of those stress lines and those furrows that they have in the glabellar region. The forehead region, you could do that. There's a few people where you can knock it out completely. It's just that, people in their 40s and above, maybe sometimes in their 30s, depending upon their features, you don't want to knock it out completely, because it makes the brow come down a little bit. Okay, and what you're trying to do is make the brow come up, and since the eyebrows are just a patch of hair in the skin that's in tug of war. These guys bring it up, all these guys kind of bring it down. You want to knock out the ones that bring it down. Kind of preserve, especially if their brows are already low. If your brows are right at that bony ridge, you probably shouldn't knock it out completely. You can damp it down as far as the movement, and I think it makes people look more peaceful and calm. But I learned a long time ago, it was like, Botox came available, I mean, really not for cosmetic reasons, but we used it for cosmetic reasons. And I found that basically if you knock out the forehead completely, they would be back in about 3 months saying, do I need an upper eyelid surgery? And that's it was just a subtlety. I mean, basically the thing you don't want in Botox is get the eyelid where it droops. That means you've probably gone a little bit deep, or the Botox kind of spread a little bit deeper.
You don't want to trade one problem for another.
Absolutely. Yeah.
Okay. Any dangers or risks associated with either the facelift or Botox? Because I know when I hear Botox, I always think, oh, you're putting poison under your skin.
Yeah, actually it's modified poison. I mean,
Okay,
basically it's
yes.
specific for the muscles. I mean, it's
Okay.
not going to go all over the place. The amount you use is very, very small. If you get a intravenous injection of it, it's not going to do anything. Okay, and that's rare too.
So you're going to be fine.
Yeah, I mean, if you put a bucket in there, then that would probably be an issue. But then, people with like cerebral palsy or people with bad spasms, so they get a lot more Botox than basically I'm doing, and they really don't have a big issue with it. Release their spasms. It allows them to move a little bit better. It's a very, very beneficial for both medical reasons as well as for cosmetic reasons.
Any risks with the facelift?
Not really. I mean, we want to be reasonably healthy and things. I mean, we, like I said, we do it under local sedation in the majority of cases. Men, I'll put to sleep just because if they were to move a little bit, they tend to move more than women. So it's better just kind of have them kind of completely out. 10%, I mean, and I haven't really seen it that much in my practice, but I have seen it and things, is you want to check them back kind of the next day, okay, to make sure they don't have any bleeding underneath those flaps.
Okay.
When you finish and stuff, everything's dry, okay, but if someone has nausea, vomiting afterwards, and they put pressure on things, they can get a little hematoma underneath there. And what happens with a hematoma, your body will absorb it and things, but it's probably better to go in and basically take it out and things than put everything back together. It takes a long time for the bruising to go away. They get a little bit more scar tissue underneath there, but that's the only thing that basically I've seen. Losing some tissue behind the ear, it's uncommon, but it does happen. It varies from one person to another person how thick their skin is back here anyway. Thicker the skin, the less likely that's going to happen.
Okay.
Thin skin, yeah, you'll see it. I rarely see anything in front of the ear. Sometimes people will feel the little stitches. I do put some permanent stitches in, but after about 6 months, then I'll take them out. It's not that it hurts or anything, but some people, from a feel standpoint of view, would rather have it out. But I want all this stuff to kind of set up and can be completely healed before you take those out.
Talk to me about that healing a little bit. Is there a lot of bruising? How long is it going to be until your face looks normal and you feel comfortable being out with your friends and family and stuff?
Yeah, actually about 7 to 10 days. I mean, really, in some people, they really don't have any bruising. But if people get bruising, it'll be down here because, any bruising that was up here tends to kind of drift downhill. It's not hard to cover that up with makeup. Okay, people do it all the time. The stitches, the ones in front of the ear, I like to take out about 7 days. And then the ones behind it probably in about 10 days. That prevents, the little train track things that you'll see in stitches that have been left in too long. But really, that's you do put little drains underneath the skin right after the operation too. If there is a little bleeding or seroma formation, things that it takes that out and allows that skin to kind of stick down. I usually take those out at 24 hours.
Okay, good to know, good to know. Well, we've got another caller on the line. Anne, what's your question?
Yes, I have Botox injections done several times a year usually, and I just recently had them done on my forehead, and it seems that one of my eyelids is sagging now, and it was prior to the Botox injection.
Yes.
And I don't see, these are reputable people, and I even went back one other time a few weeks later, and he did another injection or two, but it's still sagging.
Yeah.
And I've never had this issue before.
Yeah, the biggest, it doesn't happen frequently, but lowering an eyelid can happen. What happens is when you put that Botox, especially in this region here, the nerve that goes to your forehead comes out of a little hole in the bone or a little notch in the bone. Most people can feel a little notch. And that's a pathway for Botox to kind of drift behind that bone and into the orbit. Okay, and right behind there is the thin muscle that raises your eyelid. And if it gets Botox in it, then it will weaken it. It will come back. It takes about 4 to 6 weeks to wear off. Maybe a little bit longer, depending upon how much Botox was put in there. But that's the thing you're trying to avoid. I don't do multiple little sticks along that muscle. I will make my little stick here and I'll run it inside the muscle. I'm trying to avoid getting close to the nerve that kind of runs there, because it can drift back along that nerve and lower someone's eyelid.
So what's next? Does she just have to wait till it wears off, basically?
There's not a cure for it. Sometimes you can use some special eye drops that'll elevate the eyelid a couple of millimeters. It has to do with a different muscle that's not paralyzed. But that's about the best you can do besides letting it wear off.
Okay. Does that answer your question, Ann?
Yes, it did. But does age have anything to do with it? Now, I'm 68. Of course, I've had Botox injections ever since they came out. I tried to take advantage of all the cosmetic procedures. But does age have anything to do with it? Someone had suggested that it might.
No, it doesn't. No, age. A muscle's a muscle. It's just an anatomy issue and where the Botox was injected. Again, it does happen often. I mean, have I seen it in my practice? Yeah, I've seen it about twice. I mean, it just lowers it a little bit. It's annoying to whoever's it's associated with, but it does wear off. But it's one of those features of Botox. You try to avoid it. Again, I try to avoid it by putting the Botox more superficial in the muscle, because it diffuses about half a centimeter in each direction, and if it's down there by the nerve, that half a centimeter is kind of significant as far as where it will go. It'll get behind the orbit and affect that it's called levator muscle of the eyelid.
All right. Well, thank you so much. I'm enjoying this program. Thank you.
You're
yes,
welcome.
Thanks for
My
calling
pleasure.
in, Ann. We appreciate it. We still have a few minutes left, so if you have a question, give us a call, 219-4569. We're talking about making your face look younger. We're talking about Botox, facelift, neck lift, the whole nine.
Whole nine.
The whole
fat
nine.
injections in the face or lips.
Do a lot of people come in saying, I think I need surgery, and you wind up saying, actually, let's just go ahead and do Botox?
Yes.
Yeah.
And they're usually younger people.
Gotcha.
In their 30s or early 40s, and they really don't need a facelift. Botox works better for them. They generally don't have jowls. Their neck really hasn't taken on contours that that look bad. They'll come in and say, well, I want to start doing things early. Early is a relative term. Like I say, every time you have to come back and do a facelift, there's a little bit more risk in terms of the nerves or motion of the mouth. Knock on wood and things. I haven't had a problem with that, but that's what you run into. So I might be a little conservative, when it comes to younger people. I think basically if you elevate their cheeks and stuff, they'll look younger, because it's more of a heart-shaped face.
Yeah.
Like I say, over time, as this drops and things, we get a little bit more jowls and we get more of a squarer appearance to our face. And then, of course, the neck has its own issues. The more you can make someone look a little more heart-shaped, the better off they are.
What about frozen facial expressions? The Hollywood joke where they walk around and they'll be like, I want to smile, but I can't. That is so funny. Ha ha ha. And you can't even. I know it's wildly exaggerated, but you do see that in some, or you used to at least see that in some Hollywood folks, and that's where the joke comes from. So what's it like now? Can that still happen, or is that just overdoing certain things?
It's overdoing Botox. I'm not the biggest advocate on everything from here up not moving. I mean, some people want it that way, and again, I try to avoid it in the forehead, because most people will drop their eyebrows, and I think a more hooded eyebrow is the more crowded the upper eyelid looks, the older someone looks.
True.
Okay. The more elevated, especially women, that the eyebrow is and things, the younger they look. If you knock out the forehead completely, especially laterally, it tends to drop the eyebrows laterally and tend to crowd that upper eyelid. So I encourage people to, at least in my practice, get the motion down, but don't take out all the tone for that very reason. If you're talking about frozen faces, again, that's more of a Hollywood, Tim Allen kind of issue.
Right.
You don't inject Botox in the muscles of facial expression out here, like smiling and things like that. And people have little wrinkles up here and things. A little bit of Botox in there goes a long way as far as reducing the tone and contraction of the skin in that region, because that's what causes the lines. Again, as the skin becomes more plastic than elastic, the more you move that back and forth and things, even if you're not a smoker, you know, the more those little lines you can get. I grew up in a generation where basically there was lots of sun tanning and things like that, and some people, they really have skin like leather, okay, and they're the ones that basically will, get those little lines. Botox helps with that. We also have lasers that we use to kind of, dampen down the depth of the wrinkles, as well as kind of clean up the tone discrepancies we get over time, like sun aging, like with age spots. We have some treatments for melasma, which is that kind of mask of pregnancy they call it, where they have a little dark spot. It has a genetic component as well as a hormonal component. No one knows exactly how it works, but we have some lasers that really help with that.
Well, besides maybe staying out of the sun, anything else you can do to try to keep your face looking young?
Well, you want to use something, like I say, as you get age and stuff, you lose certain hormones. And again, I'm a big advocate of using a good skincare that has, some retin A or retinol, vitamin C serum, because it's all about maintaining collagen.
Okay.
I mean, the more collagen you have damaged and the more collagen that you lose, the more leather-like the skin's going to be.
So we're just talking about topical creams that you can get at the pharmacy,
yes,
wherever.
Yeah. You can do those, and something again, some of the laser treatments and the photofacials, it's a stimulant to the skin and the cells that are there, and when they get stimulated, they'll make more collagen and elastic fiber. So there's some programs and methods you can use to increase the amount of collagen, make the skin look more uniformed in color, and really tighten up the little fine wrinkles that they're associated with around the eyes. Those can be lasers or even peels. I think lasers work a little bit better than peels.
Okay. How much younger can you make somebody look?
Depends upon the person. I've done some face.
Putting you on the spot.
Well, yeah.
How many years can you shave off me, doctor?
Well, I'll tell you, I've done some where basically I probably shaved off too much and things. I mean, it bothers them for a while. There's kind of an adjustment because they've seen a big neck, and the jowls for the longest period of time, and
then all of a sudden they're getting carded.
Yeah.
When they go out to have a drink.
It's along the lines. It's just, the mind's a funny thing. We have a certain body image that we carry around with us, and when it changes, it to your mind, it's a distortion. Even though it looks younger or something that you want, but your mind's a funny thing.
Yeah.
And the operations that we do and things, as far as body image and getting used to it and things, the number one is a rhinoplasty or a nose job.
Right.
Because it changes your face.
Yeah.
You
look like a different person
you really
sometimes.
Do. Absolutely. Things.
Yeah.
It looks better, but
Right.
It's
Ashley Simpson is a big one. I didn't recognize her when she got her rhinoplasty.
yes.
So Jessica Simpson's little sister, for those of you who don't know.
It will change that, and even for that person, even though they like the results, you can tell by the first month or so afterwards when they come in, for a post-op visit and things, and you ask them, do they like it, and they go, yeah, I like it. It's kind of what I wanted. 6 months later, say, yeah, I love it.
Yeah.
Yeah, because it's an adjustment.
You have to get used to your new look.
Right, and it's so funny with the cosmetic procedures. The reason you do pre and post-op pictures and stuff is really to remind the patient what they look like before.
They sometimes forget.
Oh, absolutely.
Yeah.
Oh, they absolutely forget and things. Like with mommy makeovers and that, they like what they see and things like that, and then when you show them that pre-op picture, they really like what they see.
They have new respect for it all of a sudden.
Yeah, because they've forgotten. I mean, it's absolutely incredible.
Because they just get used to it.
Yeah, they get used to it, and they do not remember.
Talk to me a little bit about pain. What kind of pain are we talking about when you get either the facelift or Botox? I know some people just get the straight up Botox without any numbing cream.
Yeah, I don't use numbing cream.
No?
No, it doesn't. I mean, I haven't seen much value to it. If you're going to use numbing cream, you can put it in this region, because this tends to be a little more sensitive, but by the time you put it on, you wait that 20 minutes or 30 minutes or stuff, you could have been in and out, just by sucking it up, kind of pinching it up.
Man up, pain is beauty.
Yeah,
Beauty is
again,
pain.
like, today I had a couple that basically were a little bit more weenies than others, but most of them are tolerant. And
that would be me.
And they tend to get better over time. I mean, the first time they do it and things are, they're kind of, and then they come in, say this is their third time and things. they're not too bad. They might
Yeah.
whine a little bit, but again, I don't know why they progressively get better, because I guess they just know what's coming.
Yeah.
Now for facelifts, I mean, there's really not, it's truly more of a nuisance discomfort than a pain.
Okay.
I mean,
That's good to know.
yeah, you bundle them up afterwards and things. Like I said, I never get called for pain medications after a facelift. You
Yeah.
know, I mean, and really any head and neck thing except for ears. Ears, it can bother people a little bit more because you have to kind
Right.
of put the bandage on. It puts a little pressure.
Well, we're going to have to talk more about this some other time because we are just out of time.
Okay.
We get chatting too much. Thanks for being here, though.
Oh,
Have a
my
great day,
pleasure.
everybody. Bye-bye.